Welcome to Newtown Sport Clinic, a clinic dedicated towards all things knee, tendon, and ligament related. In this video, we will begin by providing an overview of some background information pertaining to the knee and its ligaments, and then move on to some novel treatments. We will then follow up with an interview with our expert, and then conclude with some key findings and a summary of what we learned today. Kiara is a 17-year-old basketball athlete playing for her varsity school team. Unfortunately, during her national state championships, she suffered a meniscus tear and is seeking help and treatment. The meniscus of the knee is a C-shaped piece of tough, rubbery cartilage that acts as a shock absorber between the shin and thigh bone. It can commonly be torn if you suddenly twist your knee while bearing weight on it. Unfortunately, treatments for a torn meniscus greatly rely on surgical repair. While many do suggest that some tears are able to heal without treatment, it is a much safer bet to take precautionary measures, especially in Kiara's case, to ensure that she is able to return to the court as soon as possible. However, these procedures are typically expensive, further creating barriers to accessible treatments. To further exacerbate the situation, the procedure itself is also very invasive and leads to a long recovery period that is dependent on an athlete's discipline and commitment. While these are often never overlooked, it oftentimes can be a very discouraging process, preventing one from returning to the same level of competition they were once at. Fortunately, at Newtown Sport Clinic, we are exploring the use of a novel treatment, platelet-rich plasma injections, or PRP for short. PRP leverages the body's natural production and use of platelets, a type of blood cell that plays a key role in healing throughout the body. Platelets are known for their clotting abilities, which involve reducing blood loss to injury, but also have growth factor molecules that can stimulate the regeneration of different cells and tissues in a treated area. To further learn about PRP injections, we'll have a short discussion with Dr. Hisham Ali.
My name is Hisham Ali. I am a physician. Most of my work is in hospitalist medicine, which is inpatient medicine. So I'm a family medicine trained GP hospitalist, in which we do a lot of rehab medicine as well. And more recently, I've started to do some outpatient procedures in a field called interventional orthobiologics, which we can talk about a little bit later. I'm by no means a superseded expert in this matter. However, I do have a significant interest in this matter, given that it is cutting edge. It is newer medicine that's been only around for a decade and a half, and is picking up more and more evidence. So I am interested in that field as we go along. So thank you for having me. Sure. Yeah, so the field is, it's a newer field. It's called interventional orthobiologics. So ortho is, anything to do with the bone, musculoskeletal, that's sort of what it sort of alludes to. And biologics are, things that are, non-traditional or not, or medications or medicine that sort of is more or less organic from the body, if you will. So one of the focuses that I have, or the foci that I have within interventional orthobiologics, is something called PRP, which is platelet-rich plasma. What it is basically extracting the patient's own blood, just like you would when you get blood work done, taking it, centrifuging it, and isolating the platelets part of the blood. And this practice started about 15 to 20 years ago, when, a group of physicians, basically different parts of the world, they were able to, notice that when they did that and they injected the platelet-rich plasma into tissue or into joints where there was injury, it helped with healing. Obviously, it was a lot more primitive back then and not mainstream, and now it's becoming more and more common. And the way I sort of stumbled upon it was, through a personal journey of injuring my own knee, having a ACL tear, which is the anterior cruciate ligament in the knee, which is one of the most important ligaments in the knee to keep it stable, and having surgery done there, and then recovering and going back to full full play. I played a lot of sports, so going back to full play and then re-injuring it while playing soccer again. And at that point in time, when I tore it, I looked for alternative methods as opposed to surgery, because surgery is a very long recovery process. It takes about a year and a half. For those of you who follow professional sports know that any professional athlete that does get an ACL injury, it's, they're done for the season or for a year at least. So I didn't want to go down the surgical route, so I looked around, looked at alternative options, and I'm a clinical lecturer at U of T. So one of my students actually mentioned that he was doing some electives in sports medicine, and they came across, or they were exposed to something called PRP. So I did some more research on it, looked into it, and then ended up getting the PRP injection for my knee, which is the platelet-rich plasma, and it fortunately helped me with recovery, and I was back to doing full activities within a few weeks, and it basically helped me get back into playing and saving me from having surgery. Sure. So the current research that I did was the one that I presented was a poster at U of T's one of their conferences, family medicine conferences, and the poster was essentially looking at a case study of a skier who injured her knee and had multiple tears in her knee, different ligaments, different parts of the knee that were there, and how we used PRP as well as something called hyaluronic acid, which is another agent that's used for knee pain, knee arthritis, and whatnot, and those two together, and did an MRI after the injury to show the tear, and then did an MRI after treatment and showed that there was healing in the knee, which is good, but the most important part was that she was able to go back to her normal activities within 6 months and be pain-free. So that was a single case study that we did, and right now I'm working on a few different papers, mostly systematic reviews. The problem with PRP specifically, or interventional orthobiologics, whenever you take something from the body, whether it's platelets, blood, stem cells, whatever else it might be, is that it's hard to replicate because each individual's biological profile is different, right? So it's hard to have a quote unquote standardized arm, if you will. So a lot of these studies are, case studies, a lot of them are anecdotal. But generally speaking, there is evidence out there. It's just a matter of collating that evidence. So what I'm trying to do is look at systematic reviews. My focus is mostly the knees. Look at systematic reviews, look at other interventions for knee pain or knee arthritis, for example, like steroids, like hyaluronic acid, and like PRP, and compare them head to head based on the current literature that we have available. So we have information for patients to make informed decisions when they decide what they want to do and how they want to do it. That's one of them. Then you look at trauma. So that's osteoarthritis, and you look at trauma. So ACL tears, meniscal tears, LCL, MCL, whatever else it might be. All those important parts of the knee that are involved in mostly sports injuries, right? So traumatic sports injuries, and looking to see if PRP has a role in treating those, and or hyaluronic acid and treating those injuries to avoid surgery or to optimize post-surgical recovery. Like for example, if you look at Aaron Rodgers right now, for those who follow football, part of what he had done, and one of the reasons why he's recovering so quickly from his Achilles tear, is that he had interventional orthobiologic intervention for him post-surgery or during surgery. I don't know the exact details where he was where the PRP did play a role. So it is fascinating because it's basically what PRP is, what the platelets are basically, they have a huge host of growth factors inside of them, anti-inflammatory factors inside of them, etc., that when injected to the joint in question are able to cause healing and regeneration, which is phenomenal when you think about it.
In summary, PRP treatment provides the novel opportunity for athletes of all sports to receive adequate therapy that shows great promise. Research shows evidence of reduced recovery periods, and non-invasive procedures further help athletes recover to their very best. Through leveraging the body's natural regenerative properties, this treatment tackles existing barriers to accessible treatment.